Okay, good afternoon. We're just after 4 p.m. We are recording this, so we will be sending this out to everybody later on this week as well for those that missed it. And of course, we're going to be having it on our agent portal. However, I just did think of this for those that missed this call, and this is on the agent portal as a recording, and they don't have access to the agent portal, then they may never get to see it. So anyway, that just occurred to me this afternoon. So thank you so much for joining us. This will be pretty straightforward today. This is really about one of the new aspects of the agent portal. And this is the sales and enrollment reporting tool that we are using, AMA is using. It's not connected to Berwick. It's not connected to any of that. This is really to help you understand what out of your activities brings in your best ROI, as in return on investment, but also for AMA sponsored events as well. So of course you can use this to report your enrollments. Just to let you know, I do not get a email every time it's reported, but I can pull a report off. And also you get the opportunity to pull your own report off as well. So this is a really good opportunity for you to track your enrollments, what you're doing throughout AEP and throughout the year as well. This will be open year round. So we'll get started without further ado. So hopefully by now, most of you have access to our portal. I know I've seen a lot of you communicate to me, hey, how do I get on the portal? How do I get this? Well, towards August, you were actually sent a link directly from me to allow you to actually log into the portal. We are going to redo this as well. So we're going to send out brand new links to you, and they're going to come directly from WordPress, which is where our website is made. So in fact, we did a test today for somebody and they were able to get access straight into the portal. And what it will be an email that actually states, here is a reset, click this link and you can get into the AMA portal, and it's going to come from WordPress. You should see that over the next couple of days, probably likely tomorrow or Thursday. And that will be an email from WordPress. If you haven't seen one by Friday, please do me a favor and search in your junk and everything for WordPress. That's where it's going to come into. So this is what it will look like once you sign in. You can then sign in using the tool here. Nice and easy. You log into our portal, and then it says you are now logged in. Then when you scroll up here, you click the agent portal, and then this gives you all of the different resources that are available. As you can see, we've got our video library here with all of the trainings that we've done, and they will be listed on here for the next little while. Again, we'll be updating these, and some of the new functionalities will be on here as well. And as you can see, you've got helpful resources. That's where all of your documents will be. So any documents you want to see, any blank forms, they're all going to be listed under here. Just to let you know, we've got the brand new 2024 needs assessment worksheet on here for your convenience. So this is the brand new form that is available to you, and it's a 5-page document including everything you need on that needs assessment as well, and everything you need to fill out your scope of appointment. You've got the Medicare and New Book as well. That's important here, and that's going to show that's what your clients get every single year. And then, of course, all the Berwick communication catalogs that you get. We also have the blank scope of appointment form, the blank needs assessment, and the blank permission to contact form. They're all here for you. And again, you can use all of those forms. And then we've got some of those Social Security documents that you can use to help your clients that, for example, are coming off for employer plans. So this is a request for employment information. So any clients that are coming off an employer plan, they will need to use that form there, which is the L564 form as well. We also have the form CMS 40B. And again, that's the next form here that you are going to be able to use here as well. And then that form is That form obviously then helps there with your Medicare Part B enrollment form. So if you want to enroll somebody into Medicare Part B, that's the form to use. And then here you've got the IRMA form, the income adjusted form there. So if any of your folks are on a higher premium for Part B and D, then you can utilize that form as well. So I wanted to show you some of the other tools we have on here to use. Hopefully you've had the opportunity to log back in to your portal and utilize this. Of course, you've also got some links here as well. They're going to help you log into some of those websites that you use. So your Medicare Center for your quotes and selling, Agent Way, that allows you to see your own contracts and some of your production through Berwick. And of course, the agency dashboard if you're a GA, your Berwick portal, and then some of the other national Medicare links here, Medicare.gov, AHIP, Social Security. And then if you want to get your license in another state, you can get that through NIPR. And these links are all available for you. But obviously, we came here today to talk a little bit about this new reporting form. So again, what I want to do is show you exactly what this is and how we would like you to report here as well. And just to let you know, I'm showing you this on my laptop here, but this is available for you to see using your cell phone. So you can actually log into the portal exactly the same way using your cell phone. It is eligible and it brings everything up so you can see everything remotely on that cell phone. So again, if you are in a resource center, one of our Medicare resource centers, or you are doing a sales event that is either sponsored or provided by AMA, we do require you to send this to us every single time you're at one of these events. So we will be sending this out to those agents that weren't able to make today's call on an email as a link here, and we'll be providing that information for you. So let's get right into it. So on the event calendar, if you come down to the sales reporting tool, you actually hover over it. You can see the little hand there. So it links straight to the form. And then you're just going to scroll down on that form here. And this is the information we are going to require for you. As you can see, there's 8 fields to fill out. It should take you between 2 minutes and 2.5 minutes every time you are participating in an event. So let's just take you through this. So you got a meeting place. Well, there's either two things. There's going to be your Medicare Resource Center. So if you are participating as agent of the day in a Medicare Resource Center, or you are covering a shift, you're going to click Medicare Resource Center. Any other sales event, you're going to click a sales event. This could be informal or formal. So it doesn't matter which one. You're going to click sales event or Medicare Resource Center. We are just going to click here, that sales event form, and then you're going to put the event name. So if you're doing a sales event at Walmart, then you're going to click in here, Walmart. Okay, nice and easy. If you're doing a CVS, you're going to put CVS. If you do something else, you're going to put something else in here as well. So please make sure you're completing that. And yeah, you're going to have to fill that out here as well. So that's the information you're going to need here. So Walmart is that type of meeting. So again, this is for your type of meeting for any walk-ins, attendees, or appointments. So for example, if you're doing a sales event, that's going to be attendees, right? Because you're going to have attendees at that sales event. If you're going to be doing an informal sales event, it might be walk-ins. And then any carriers, so you can select all that applies. So if you're doing Walmart, then you can actually click on some of these carriers. Again, you got Anthem there, which is part of this program, United Healthcare, and that might be just the two that you're representing. Event date, it's easy, comes up with a calendar. It should come up with the date we're on today. So let's click on that date. What are we, the 10th of October today? You've clicked that, it's come straight in there. Event location, well, that's a required. So that can be, for example, 123 Street, Las Vegas, or whatever you want to do. Nevada 89119. Okay, and then you're going to put on there how many enrollments have you done during that day, and that's as simple as this: 1 or 0. Plan types, well, I did 0 MAPD, so you're not going to need to fill that out. But if you did 2 and you did 1 MAPD and maybe 1 Medicare supplement, you're going to do that, and then you're going to hit submit. That's as simple as that. Once it's done, you can see that the form then goes blank. And of course, if you did more than one sales event or sales meeting during that day, we're just going to have you complete it for each event. So for example, you might have done a Medicare Resource Center afterwards. Event name, MRC Northridge or Pahrump or Thousand Oaks. That's as simple as that. We just want that information. Type of meeting. So these could be appointments. Say you had an appointment here. Carriers, or if you had an appointment and I was able to do Scan Health Plan, for example, you're going to put that in there. Event date, I think we found that pretty easy. Event location is just the address, 123 Address Street. And then your total enrollment. So you did one appointment, you didn't enroll them. You're going to go to 0. And again, there's no plans to put, so you'll just submit that. But the appointment was for an MAPD. You're actually going to need to put that in. That is a required field. I didn't see that little part. And then again, that's going to be that. So that, as you can see, that is pretty straightforward and easy to do. This is all we require you to do. And of course, what we can do from everybody putting this information in, the only person that's going to get to see this information is me. And what am I going to use this for? I'm going to use this purely to see what and how successful these events were. So this is where I'm going to get to see that information. What are you going to get to see? Well, once you start filling this out, you can actually run your own reports. So in here, you're going to get to run your report here, and that's going to automatically here show that. And these are just some things that I've done on my own here. So it actually shows my own report. You're going to get to see your own report from what you've done as well. So I've actually put some of this information in here as again, and you can see what that information shows. So it's nice and simple. You're going to be able to do that report, download that report. You can actually select the report by resource center, by type of meeting, carrier name, plan type, or date. So as you put information in, you're going to be able to show where you were more successful on these events as well. And of course, you can see what enrollments we had as well. And this is obviously the one I just put in today. And this is the one I put in there as well. And then these were just 2 events that I was doing last week in testing it. So this is going to allow you to show all of that information there. And of course, we'll be able to download those reports, or I will be able to download those reports to actually bring those reports into an Excel file as well. So literally, that is the information that you're going to be able to have on here. It's very simple, and we wanted to make it simple. We didn't want to make this a complicated process. And of course, as time goes on, you can check which of your events are the most successful for you. And you're going to be able to see your own events. I'm going to be able to see all of AMA events. And we would like those reports started really as soon as you possibly can. We're just coming into AEP. And of course, this is where that information is going to be vital. As I said, this is for me to really see how these events are bringing us enrollments, and any return on investment that we are providing for these events is going to give us that information as well. I know some of you are doing sales events, and you might have a lot more folks turn up for these sales events. So of course, you're going to have a lot more information to put in. And of course, you do your sales event. It could be formal UHC event. And of course, attendees. And it might be for a specific carrier here as well. So again, we're going to have that information in here. but you can do, you can put a number of different carriers on here. Your event date is just what I've just mentioned, location, total enrollments. And that's what we want to find out here, is how many enrollments that you guys are able to do at these different events. And of course, you just submit that information as well. And you have to fill out every single line. There's only 1, 2, 3, 6 lines here that are you have to complete. And then the carriers, you've got to fill your drop downs in to the carrier and plan types as well. Simple. And we wanted to make sure we do that as well. So let's look about this. So a couple of questions here. And again, please put your questions in the Q&A. So this form is not file the event with CMS. Absolutely not. It's about reporting sales to AMA. That's what I said at the beginning here. But again, please put your questions in the Q&A. They seem to have all gone into the chat. What about follow-up appointments? If you're doing a follow-up appointment, which has come from being part of an event, then we're going to want you to do that as well. Phone enrollments don't have to go on here unless they have come out of an AMA sponsored event. This is supposed to really give me that information mainly around the AMA sponsored event. So if we are doing advertising for you, or we are participating in a co-op program with a carrier, these are going to be those type of events. So I'll give you an idea. If we're doing Senior Expo here in Las Vegas, then these are the events we want you to report. If you are sat in a Medicare Resource Center, well, AMA is providing that location. Those are the events that we are going to want you to do. If you're doing a CVS kiosk, I don't require you to send that through. If you want to, then that's great, but that's not a requirement. We are not participating or paying for that location. So these are AMA sponsored events to give me an idea on that return on investment. That's what we're looking for here. Appointments of beneficiaries' houses do not need to be put on here. These are purely for formal and informal sales events that AMA have participated in. And of course, we have that here. If we're missing carriers, we are in the process of getting those added. So those carriers will be on here as well. This will not necessarily tie to the commission because, again, this is purely for events that AMA is sponsoring. This is not a commission report. This is a report to support the events that we are sponsoring so we can look and decide what events we are going to do next year. And of course, that is going to carry on over into Q1 as well. This is going to be throughout the whole year. So we are going to require this for any AMA sponsored events throughout the year. Is there an edit feature in here? I don't think so. If you make a mistake, then you probably have to re-put this in here. Once you've clicked submit, you submit it. If you miss information off here, it won't allow you to submit. So before you hit that button, you've just got to make sure that information is correct. How do we treat a T65 sign up? If that's done at a Medicare Resource Center and you sign somebody up, this is all about ROI. So to me, this is not going to track your commissions. You're just going to put it in when you meet the client. If you've done an enrollment on November the 1st and they go effective January the 1st, it doesn't matter. We know that during that time at that sponsored event, you were able to do an enrollment. If you do, so for example, if you get 7 PTCs from an event and after the event, you end up enrolling 5, you would just need to put that on as a later date. So of course, today I was at an event, say I was at a Senior Expo and I managed to get 7 leads, but I didn't do an enrollment. You could put 0 for that day, but then 3 weeks later, if you do an enrollment from that expo event or from that walk-in that you had at a Medicare Resource Center, you could update and just go back and put the date in for the event. So when that polls all together, we're going to see what dates and what events you're going to have that in. We're trying to make this as easy as possible on there. And again, as you're closing leads, you would just go back and put that event date in. So I'll show that here. Again, Medicare Resource Center, say I was able to be here. Let's say I did an appointment and that carrier is showing Aetna, and then the event date, we're going to show that event date. Let's have a little look here. So as you can see, you can just put that date in, event location. And then I did that enrollment, and then I did an MAPD. That's as simple as that. You can go back on that date. So this actually shows you, you can actually go in and see that date. And then of course, if you look at my sales report now, you are going to have that information in there. And of course, you can see that we put the date in there. So when I pull this data, then I'm going to be able to see that report there as well. Okay. So things like camps that you are at that are not AMA sponsored, no, you don't have to put that information in. Absolutely not. This is for your purely events that AMA have sponsored. So examples would be where you are doing a formal sales meeting and have requested some co-op money or co-op marketing. These might be a kiosk that AMA has participated in supporting you for those kiosks, for example. These might be at a Medicare Resource Center. These might be for some carrier meetings that you've done, or for an existing event that you are following up. It might be for a informal event that you've done following a educational event that AMA is participating in for co-op. It might be for a specific campaign that AMA is part of. For example, with Providence, we did a campaign last week. Those will be kiosks and camps that you will need to participate and provide that information in. These are purely for that information as well. Pavilions is provided for you purely through your carrier. You don't have to list that in here. It's the same thing with Smiths, the same thing with CVS. None of those kiosks you don't have to do. These are purely those events that you know that AMA is sponsored. If you want to provide that information, great. The more information, the better. But the reality is I'm going to use this to track only our ROI on some of these different events that we're doing. So I think that's about it for today. Thank you so much for all of you coming on today. This was really here to help you guys understand how to utilize this. Of course, your portal is for you as well. So don't forget that information can be used for you. So I'm just telling you what we are requiring you to do. If you want to track your own enrollments through this tool and through the sales tool, can you do that? Absolutely. I don't have a problem at all you tracking this for all of your own enrollments. And of course, the more data we have in here, we can pull that data by date, by location, by event. As long as you put the description of the event in, and that's why we try to make this as easy as possible. So we're going to make sure those events are all going to be tracked for you. So the important thing is here, whatever you report, the minimum has to be all of AMA sponsored events. If you want to do your own enrollments and have them listed in here to keep track of them, absolutely you can. It's not going to help keep track of your clients, but what it is, it's going to help you keep track for next year and following on from this, really where that information can be downloaded. That information can be put in here as well. And you're going to be able to have that information for you at a touch of a button there as well. As you can see, that information for you individually is going to be kept in here. So you can have your own sales reporting on there. So it's up to you how much you want to use it for. My requirements is only for AMA sponsored events as well. Does the channel 3 from tonight need to be added? Yes, please. Absolutely. That's an AMA sponsored event that we've partnered with SCAN. So please be partnering with that as well. We need that information in. So thank you so much for asking those questions. Okay, well, I think that's it. We're at 426. I know you guys are probably thinking, look, you know, maybe you want to absolutely put every single other event in there, and that's fine. If this is the way you want to track how you do in AEP, absolutely, this is fine. You can do that. This is a tool for you as an independent agent. It's for you as an individual to help track your own enrollments if you want. My requirements are one thing. If you want to track everything that you're doing in your activity to see where your own activity is giving you a return on investment and a return on your time, then this is a tool to be able to do that. We made it simple. Hopefully you found this pretty simple to use there. And, you know, we could have added a ton of other stuff on here, but the reality is the more we add, the less feedback we're going to get. And this is why we wanted to make this a simple process. Thank you so much for joining us today. I'm going to stop the call now. And if you've got any questions following from this, please reach out to myself or one of my team. Have a great day.